Hi, I'm Teresa Chang.
Hi, I'm Felicia Grant Cummings.
Hi, I'm Kim Johnson with Moms Navigating Autism.
Welcome to the show. Tonight we have Naomi Brickel from WIHD. WIHD is one of those places that has so many arms, and I'm hoping you could tell us about WIHD and the different services that people could access through them. And then we also want to hear about you. I mean, you've written articles for various journals, and they're always so interesting and very informative.
I'm the director of the Community Support Network at Westchester Institute for Human Development, and we're located in Valhalla, New York. And we're something called the University Center for Excellence on Developmental Disabilities. There's actually 68 UCEDs, as they're called, around the country, and they go back all the way to JFK, who started the funding to really develop best practices around services for people with intellectual and developmental disabilities. So we are one of 3 UCEDs in New York State. And really all of the UCEDs share a common vision, mission, and that is really to help the world become a better place for people with intellectual and developmental disabilities, be able to live and become active participants, living their best lives in the community. So a lot of the themes that you'll hear coming out of UCEDs are employment for people with IDD, community-based employment. You'll hear things around self-determination, person-centered planning, things that really are initiatives that really are focused on the dignity of the individual and each human's right to live and participate in their community and contribute to their communities. So as one of the 3 UCEDs in New York, we're pretty large. We're one of the only UCEDs that are a nonprofit. So we happen to not be just part of a university, but to be a separate nonprofit entity. And we have a lot of programs at WIHD, including medical and clinical services for people with IDD. We have really large, robust dental clinic that's very well renowned for its services for people with autism and other developmental disabilities. And then my department is really about systems navigation for all stakeholders. So the Community Support Network is the department that I oversee, and we are a broad array of programs with different funding sources to help families navigate all of the disability service systems across the lifespan, from early intervention through preschool special education, through school-age special education, and into the adult developmental disabilities world in New York, OPWDD. We provide self-direction brokerage for families, which is a more person-centered approach to OPWD services and funding. And we have numerous state grants to help families navigate the disability service systems, but we also work with school districts and agencies to doing professional development and also innovative program design. So we're very focused on helping to develop programs that are really community-based, inclusive, person-centered. We've done things like employment training programs. We recently started one at Lawrence Hospital, something called Project Search, which is a 1-year, really 9 months. It's like approximately a school year employment training program where individuals with autism and intellectual disabilities participate in this program. Project Search is an internationally recognized program. It's evidence-based, and it has about a 70, I believe their overall employment rate after program is about 70%. In my past decade at WIHD, I've worked on the development of several programs, a few of which have had 100% employment many years. Again, the employment of people with the developmental disabilities is somewhere around anywhere ranging from under 10 to 20%. So to have programs that are so innovative and effective, right, that really lead to real outcomes, real employment outcomes, is so powerful.
Yeah.
So like I said, we also work with schools. We work with schools on family engagement, helping them improve their practices around, appropriate family engagement and special education. So we have a real robust programming for self-advocates that's really developed. We had pieces of it in place for over a decade, but really has developed a lot in the last 3 to 4 years, maybe more than that now, actually probably more than that now. We have a young man, Brendan Klein, who we
Yeah.
know here.
Had on the show.
Yeah.
Yeah.
Who does social groups and recreational programs. We also have a group called Hear Our Voices, which is a monthly kind of networking group for individuals with autism and intellectual disabilities, where they have speakers that they select on topics that are of interest to them, like topics related to their community living and being more successful in their adult life. And then one of the cool programs that we've recently developed is it's called our Speakers Network, where some of our self-advocates have received training and do presentations all over the place, colleges, medical schools, legislators, where they rather than just giving an individual a microphone and letting them talk, which all of us know that you hand me a microphone, it doesn't necessarily mean I'm going to be an effective speaker. So they really receive training so that they can be very credible voices for the issues that they've self-selected as important to them.
I know people who have gone down there for dental services, and I've known people who've gone down there for counseling, and I've known there, like I said, you have so many different areas in that place.
How many people would you say they serve as far as the dental and stuff like that? How many individuals? Because I know my son uses those services. It's a long wait list just for these individuals.
I don't know exactly the dental, but WIHD as a whole serves thousands and thousands of people every year.
And this is one of the only ones that really, caters to this population, really. I mean, I don't know of any other one.
We have people in our yes, we have people in the dental clinic that come from as far as Albany and the tip of Long Island. So
wow,
it's a great program.
Yeah, it's pretty big. So
it's amazing. Places like WIHD are important because it provides the training, it provides counseling, it provides so many different things.
Can you tell us exactly what services they have? Like, I know they have dental. My son does psychology there. He's a psychiatrist there. I guess they have physiatry.
They have all different medical specialties in our clinic. There's also audiology, speech. We have an amazing,
EI is there, right? EI is there also.
Service coordination. Yep. We also have a very well-renowned assistive technology department.
Yes, this is assistive.
A loan closet too, right? Yeah.
And the loan closet is part of that. Yep. We have, a lot of people aren't as aware because it serves people in foster care systems, so not everyone's impacted, but we have a very large department that provides all kinds of programming within the child welfare system as well.
Wow. Now, are you guys in with the Child Advocacy Center? Is that in the same place or is that different?
Yes, the Children's Advocacy Center is part of our child welfare.
I remember going down there was a couple of meetings that you had, but you also had the Section 8 and for people with disabilities and how to get them, and you brought in the lady from Section 8.
Yeah, that's one of the programs we have in the community support network. Some of our self-direction brokers are trained as housing navigators. So in that, as your kids get to that transition into adulthood, we have experts on helping families develop, community-based and even navigating the certified residential program through OPWDD.
Yeah.
We have a really cool for families utilizing and professionals within utilizing self-direction. We actually have our community support network has a Facebook page that advertises all trainings, but we also have groups that are specific to targeted areas. And one of the ones that's really robust and interactive is our group that's for self-direction families and professionals. So we get a lot of interaction between families and professionals in that forum as well.
Oh, I didn't
Can you
know.
explain that for someone who may not understand the self-direction area?
Absolutely. So I was talking a little bit earlier, but I just said it really quickly, but we are a provider of self-direction brokerage, and self-direction is more innovative and it's more person-centered process for funding OPWD services and support. So when you have a kid and you're thinking about their future, a lot of people think of the more traditional system of going to a group home and maybe going to a day program. Where self-direction is more, instead of going to that agency and getting your services through the agency, you actually are given a budget and you purchase your services. So you can hire your own staff. Like my son he supports a lot of my daughter's friends as a ComHab staff that they've hired and get paid for through the system. There's community classes you can take. So it ends up being just more inclusive and more person directed.
So I know people who go through WIHD, and I also know people who go through other agencies. Do you think it's better to go through an agency as big as WIHD, or do you think it's smaller, out of your experience?
Well, depending on what the service is, for self-direction brokerage services, WIHD currently has a wait list, and we're maxed out in our capacity. I think there's a hope to be able to scale up that business as the system catches up with some of the bumps within the infrastructure and statewide. I would say for self-direction brokerage, if it was me as a parent, I would absolutely be going to in most cases, I know of some amazing independent brokers who are smart, on the ball, capable, and committed. But as an agency, as the person who oversees our self-direction brokerage department, I know that a lot of the families that come to us are families who have been burned by the independent brokerage system. And, an agency provides a little bit more quality control, a little bit more
overseeing.
Yeah. We hear all the time from the fiscal intermediaries who are the funding, who basically fiscal intermediaries they're the payers in the self-direction system. So when you hire staff, your staff gets paid, the money comes to the person, but it comes through this fiscal intermediary. So it's this fiscal intermediary that pays the staffing. And we are very well known by the FIs, as we call them, for our quality. And we're also well known by OPWD for our quality of that service.
That's good to know.
Yeah.
Good to know. Brendan works for you. Now, if everybody remembers, Brendan was on our show last season. He ran the social skills groups, which are great.
The way Brendan came to work at WIHD was, I know Brendan's mom, and we've been friends and advocating for our kids through our whole lives. We've often kind of bounced things off each other as moms since both our kids were younger. And Brendan came to me as a potential staff person. Was one day when his mom and I were having lunch, and she was telling me about, Brendan had gone to an inclusive college program and it had finished, and he had kind of lost a way to connect with all of the friends he had made there. So she worked with him initially to set up a Facebook group that was private and was all by Facebook Messenger, where they organized events amongst this group. And it just grew and started to grow. And we were having lunch one day and she told me about it. I'm like, oh my gosh, I want to hire him. I want to hire him because this is such a need for people with disabilities to make friends. And I want him to come to WIHD where he can really not only make that program bigger, but teach people about what he's done. And I mean, Brendan's spoken at national conferences on what he's done. And he organizes over 100 events a year.
It does.
So it's amazing. And Brendan has really, he's evolved from doing his social groups into really doing, in addition to his social groups, he's become a real leader in a real leader in the disability community. And he does a lot of political advocacy. He goes to Albany. He was last spring presented a citation by the chairperson of the Assembly Committee on Disabilities for his work on behalf of the disability community. So you know, Brendan's been really good for WID.
Yeah.
He has. He's been really good for the community. And I think WID has offered a platform for Brendan to really get his, you know, innovation out there and scale up his innovation in a larger way. So it's been a win-win for both of us. And our self-advocacy programming at WID has just really kind of sparked and turned into fireworks. Well, you know, since he started. And
Wow.
we now have 2 other self-advocates who we've hired leading others. So we have Claire Pollan is leading our speakers network work, which I spoke a little bit about earlier, but where we self-advocates work with a coach to develop presentations and speaking skills. They self-select an area where that they want to advocate for. Claire, who leads this work, she started by developing a presentation on for the medical community and working more effectively with individuals with disabilities. It's so powerful. So she's kind of taken the lead on that work. And then we've also recently hired a self-advocate by the name of Nicole Hastings, and Zoom has opened doors for us to expand our reach and to bring in other leaders, because Nicole lives in Syracuse, but she is leading our Hear Our Voices, which is our monthly kind of educational meetings where I spoke a little bit about earlier, where the self-advocates themselves select topics that they're interested in learning more about, developing their skills around, and then they have monthly speakers who come and speak, and it's very interactive. I was invited to be a speaker last month, and I did a session. I teach in a graduate program for WID. I teach the disability policy module, and they asked me to come. Nicole asked me to come and do a program with them, and I have to tell you, it was very interactive. So they chimed in. I kind of did an overview of disability history, but it came alive in a way that it never has for me as the teacher, hearing them speak firsthand about the issues that impact them and how these laws and this history has impacted how they live, but also how far we still need to go. So it was very powerful.
Wow. See, that's so interesting. It's wonderful.
Thank you. It's you're going to have to speak to my successor, though. As I mentioned, I'm going to be leaving, and I'm going to be heading a new project, which is also thrilling and exciting, important for your audience as well. I will be leading the Supported Decision Making New York project, and if you don't know about supported decision making, you should. It's going to be critical that families do understand what supported decision making is, because it's an alternative to guardianship. It's a facilitated process that individuals with disabilities participate in. It's an involved process, a very deliberate process, and a deliberately gradual process as well, for really helping individuals, self-advocates, individuals with disabilities learn about what decision making is and start to kind of develop their skills, but also start to understand their own capacities for decision making and work to develop a team of supporters in their decision making. And why it's important, and why I wanted to really bring it up here, is because last spring Governor Hochul signed legislation recognizing supported decision making. So it's now the law in New York State. The regulations are currently being written, but recognizing supported decision making agreements that are developed according to certain principles as a legally recognized alternative to guardianship. And that's super important for families to know about on two levels. Because one, it is an alternative to guardianship. And when a family gets guardianship, and we're all told when our kids are in high school, it's part of the checklist, get guardianship. But guardianship is, there's a human rights aspect of that. It really does take all rights from the individual, and gives parents full capacity for all the decision making of their kids. But why, so I think originally the intent behind the law was probably came from a good place, was really to protect the individuals so families could protect their kids. There have been instances of abuse. I think the majority of families who have guardianship are not abusing it. So in most regards, I think it's benign in that regard. But with this legislation last spring, surrogate courts, the surrogate judges are required to consider when an individual comes before them and their family's trying to get guardianship, they are required by law to only assign guardianship if there is not a less restrictive alternative available.
Yeah.
And with legislation, that became available. So my role in this project, it's a 3-year project funded by OPWDD to scale up the availability of and create an infrastructure for the availability of quality agreements and quality facilitation and subsequent agreements for individuals that like to go through this process and in the end have these agreements that protect the individual. There's instances, and I know them, I've experienced them firsthand because we have families that come to us. So I've heard from the families where a family may go to a doctor and the doctor could refuse to see the child, but because the family doesn't have guardianship. And with this new legislation, that doctor can't do that anymore if they have this agreement. They're required to recognize this agreement, and they're also protected from liability for agreeing to see a patient they may believe doesn't have the capacity to make those decisions. So it's an really important topic. I'm really excited. This is a really important project. I'll be working with OPWE to develop an infrastructure for it, to get the word out, to educate families, to educate agencies, to educate individuals who would be, appropriate to participate. So it's, and I'm going into it with a lot of experience, and I would say like wisdom that I've gained from really working so closely with self-advocates themselves. And we've all heard it said, nothing about me without me. But that's not always, it's sometimes like everything, some things are easier said than done. But I've really, in the past 3-4 years especially, really come to appreciate that in a way that I didn't prior to having such really amazing individuals with disabilities that are now my colleagues at WIHD. I have a blog and I have a book. I have written a book. It's not related to my work, really. It's more related to an experience in my personal life where I actually lost a child 5 years ago, and I wrote a book related to that. And my blog is mostly related to that, although in these past 2 months, I've been so busy between my 2 jobs and the transition that my last post was actually about what I've learned from the self-advocates.
Naomi, how does WIHD affect or participate in policymaking for people with disabilities in the county and then in the state?
So in the county, we participate, we have members of our organization, mostly in the community support network, who participate on monthly Department of Community Mental Health advisory committee meetings. So when we share what's going on, we also share the voice of what we're hearing and the issues impacting our constituents. One of my roles at WIHD was the coordinator of policy. We've done work on state education department. I'm a member of the state education department's commissioners advisory panel for special education. So I'm able to bring the my experience, my professional experience working with so many families over the years, and current, I meet directly with legislators on issues when they're important.
How open are they to hearing, the experiences of families in the community with, family members with disabilities? How open are they, and how much do they want to keep things at the status quo?
Well, Felicia, I would say every person who's elected into office, when we're talking about the legislators who we elect, every elected official is interested in hearing from their constituents because they know you're voting for them, so they want to give you their ear. I have found that there are some that are more responsive after what they hear to that. But I think within CSN, we have a great example of really impactful engagement. We host a conference each year on transition, for like the transition from school into adult world. It's highly focused around our population of people with, autism and intellectual disabilities, people who are more inclined to need lifelong supports. We had almost 700 people register for the conference. We had,
Wow.
And every year our closing session is a legislative town hall. And this year we had the commissioner of OPWDD who attended, and it was a facilitated discussion on really important topics that we had worked with Assemblymember Chris Burdick, who's the champion I was just talking about. And he facilitated dialogue with her about these issues and really brought to her attention our local issues.
I have a question about the annual conference. Is there a way, was it broadcast? Is there a way to still find it online or look for it?
Yes, that's a great question, and thank you. You can Google WIHD CSN Transition Institute, and that will bring you to our landing page for each year's conference. I don't think this year's conference's recorded sessions are up yet, but last year we have like around 50 sessions that are available.
You guys have where the kids come down and they learn policy making or something like that, or is it a leadership forum?
So it's called Hear Our Voices, and
okay, that's the one. Okay,
but also, Teresa, the group I was talking about, Speakers Network, that's also, like, Brendan has really worked on his speaking skills with the speakers through the Speakers Network stuff, and I mean he's become quite a force. Like, he's a very credible advocate in the disability field. Like, people stop and listen to him, and it's really hard to not stop and listen to a person, an impacted person. And when they can be credible and articulate and really speak to the issue succinctly, it's so powerful. And Brendan is an example of what you can accomplish. I have a picture of Brendan Klein sitting with Kim Hill and Carrie Neefield, who's the commissioner of OPWDD, at a table, and they're sitting there, hearing.
I'm so proud of him.
Hearing him talk about what is important to him. He's really developed a passion lately for employment. So he's amazing, and he's a real testament to how important it is to give people their voice and to help give them the skills to articulate it well.
Right. We want to thank Naomi Brickel for coming on the show.
We'd like to thank Altis for allowing us to use their platform to broadcast.
And we want to remind everybody that we are mothers. We're not professionals. We're sharing our experiences so that we can help you with your autism child.
Watch us on all social media. Don't forget to follow, like, and subscribe.